Hello, Kidney Warriors! James here from Dadvice TV, your online kidney health coach. And this is Dadvice TV Live. It's great to have all of you here. And if you're new, go ahead, introduce yourself in the comments. We got a great community here that is very supportive, very helpful, and very positive. Now, if you are new, let me quickly introduce myself. My name is James, and I have kidney disease. I was diagnosed about 2.5 years ago with stage 5 kidney failure. Things weren't looking too good, but I started working on learning about kidney disease, learning about nutrition. I started exercising, working very close with my doctors, taking care of my body as a whole. And as I got healthier, my kidney labs started to improve. But along the way, the biggest thing was learning about how my kidneys work, learning how the things that I ate, the things that I did, how did they impact my overall health? That was the key for me. Now tonight, we have a great guest. You guys know him. His name is Dr. Rowe, and he is the author of the book, Learn the Facts About Kidney Disease. Of all the kidney books, and let me tell you guys, I've bought practically every single one available on earth, I think. I've got piles and piles of them. This book is by far the single best book. And I wish doctors would give out this book to every newly diagnosed kidney patient. It's super easy to read. It's super helpful, and it's understandable. A lot of those books out there, I think they're written where you need a PhD to understand them. Not Dr. Rowe's book. He puts things easy to understand. Now tonight, Dr. Rowe is here to talk to us about dietary potassium, something a lot of kidney patients are afraid of, and we think we got to stay away from it like it's really, really evil, but sometimes it might be good to increase your amount of dietary potassium. Sometimes it's not good to increase your dietary potassium, and Dr. Rowe is going to talk to us all about that. So let's go ahead, let's jump over and let you guys meet Dr. Rowe. Hey, Dr. Rowe, welcome.
Good evening, everybody, or good morning, or wherever you are in the world, whatever time of the day it is. I'm actually in New Jersey. I live in South Carolina. I'm visiting one of my 5 children, and with 3 of my 9 grandchildren in this house, and we're having lots of fun. And from here I go to my middle daughter to visit her and her husband and her child, and then I go to Brooklyn to see my best friend. So it's going to be a nice trip. Took my first flight, so I'm real excited to be able to do that.
And you've been vaccinated. That's what made your first flight.
Yes. And for those of you, and we've encouraged you to take the vaccine. Pete, CKD is one of the risk factors that could give you a bad outcome from COVID. Please take the vaccine. And the latest data on the vaccine gets better and better. It looks like it is unlikely once you get the vaccine that you can spread COVID to other people, even if you're around someone who has COVID. So that's really good news. So the news gets better and better, and the vaccine is going to get us out of this horrible pandemic. So please take it.
Oh, yeah, and I took my first dose last Monday, so I am 1 week after my first dose. April 12th, I get my second dose, and I can't wait.
Yeah, well, there are some side effects, but the side effects are pretty mild for most people, and luckily, one of the advantages of being older is that the side effects are less for the older folks like me. But anyway, everyone should take it. And it's going to be available in most places around the U.S. for folks above 16 pretty soon, within the next month. I know it's getting slower distribution in other parts of the world, but as you get the opportunity, please take the vaccine.
Yeah. Now, for those that are new here, maybe it's their first time here, tell them a little bit about your background.
So I am a kidney specialist, retired from the active practice. I just do volunteer work at the free clinic to see kidney patients. I've got over 40 years of clinical experience with kidney patients. I started a dialysis program in Columbia, South Carolina at the VA hospital. I've done extensive clinical research, and I've done extensive patient care in my career. And I have some very highly recognized research work, especially on the issue of the best time to start dialysis. And I was just telling James, there's a author who's writing a book about the dialysis industry, and will be having my work. He's interviewed me several times about the issue of unnecessary starting dialysis, in many cases, starting dialysis too early. So with that as one of the main messages I've been trying to get out to my colleagues, I decided I wanted to get it out to patients, which is one of the reasons why I decided to write this book for you, called Learn the Facts About Kidney Disease. There's a lot of misinformation out there, and so I am hoping to get people less worried about their kidneys, less unnecessary worry, and James has given me an opportunity to get the word out and give you the actual situation with your theoretical kidney disease. And we're going to jump right into it, and I'll repeat stuff that I've said a few times here about who and who does not have a kidney problem that they need to worry about. So you let me know, James, when we're ready to start.
Hey, we are ready. Well, actually, let me. I'm going to plug your book one more time, real quick, just because it is such a good book. And what you just mentioned about the worrying about kidney disease, during the day, I will jump into some of the Facebook groups. I'll be on Reddit and the kidney disease, and I see so many people who were newly diagnosed, or they got some labs and it looks like they might have a little bit of kidney issues, and they're worried. They're very, very worried. And that's one thing that you do really good at explaining in your book, Learn the Facts About Kidney Disease, is when really is it something you need to be concerned about. And for a lot of people out there, we get really worried, really, it's an emotional roller coaster for us, but it's not as bad as it may sound when you go to Dr. Google. Getting advice from someone like Dr. Rosansky here really puts you at ease and lets you know, okay, this isn't something to worry about yet. I need to start making some changes, being a little more careful. But that's really a great point about your book, is it really helps people know how serious is it. And sometimes it could be serious, but for so many people, it really isn't. Right. So let's go ahead and, one last thing. For those of you that want to get the book, I know I'm talking a lot about it, but there's the link right there on the screen. go.dadvicetv.com/book will take you straight to Amazon, or you could visit a local bookstore, which is great to give some love to those that are local to you, and ask them to order Learn the Facts About Kidney Disease, and they can order it in for you. Then you're helping our local businesses, which is great, especially right now with COVID and the reduction in business that they've seen. All right, Dr. Rowe, let's jump into potassium and kidney disease.
So before we get into potassium and kidney disease, let's first talk about something I've talked to you about many times. I hope most of you already learned this message. And that is, why even know that you've got the primary group of you are stage 3 CKD, EGFR of 30 to 60, okay? And the reason is that you may be at a higher risk of getting what they call hardening of the arteries, atherosclerosis. And so the question is, at what point of kidney function does that risk increase? And it depends on your age. For example, if you are under 45, you probably should have a kidney number of 75 or more. If you're 45 to 60, probably 45 to 60 is a range that would be considered abnormal. But if you're, let's say, over 65 or certainly over 75, a 45 to 60 may be normal for you. So that's the first thing. The next thing is, you want to decrease your risk of hardening of the arteries, atherosclerosis, because that can give you bad outcomes like heart attacks, strokes, heart failure, the common way that most of us are going to die, unfortunately. And some of that can be prevented, and some of it can be prevented by the right lifestyle. And part of the right lifestyle, and we've talked about lifestyle issues like getting rid of those cigarettes. Number one, getting exercise, extremely important. Getting your blood pressure under control, extremely important. And so what about your diet? Well, when I got on Facebook looking at various kidney groups, I was just astounded by how people talked about protein and potassium. Like protein and potassium, if you've got a stage 3 CKD is bad. Absolutely wrong. Listen, folks, absolutely wrong. It is not bad. It is not bad. It is, as a matter of fact, it is essential.
Mm-hmm.
You should be eating, not high levels, but you should be eating a normal protein diet, and you should be eating a good amount of potassium in a plant-based diet. Unless you are getting to the point where you are at stage 4 and certainly at stage 5, your main job is to keep yourself from getting a heart attack or a stroke, angina, decreased blood flow to your extremities, and the bad outcomes from having hardenings of the arteries. And you want to do that with the lifestyle issues. And diet is one of the lifestyle issues. So the diets that we talked about once before is one of the diets is the DASH diet. It's basically a diet that dietary program that showed if you decrease the sodium, the salt in your diet, you're going to have a marked improvement in your blood pressure. And guess what? If you decrease the salt in your diet and you get on a plant-based diet, number one, you're going to decrease the potential for folks who are not having kidney disease in your family. You can decrease the potential that they ever get it. And for yourself, you can slow your decline of kidney function. You can slow the decline of your kidney function by being on a plant-based diet and following the lifestyle issues that we talked about. So what are the bad things that happen if you go on a low potassium diet? Well, low potassium diet, what does it mean? It usually means a high sodium diet, which means a lot of processed foods. When you look at processed foods, it's got tons and tons of sodium. And the natural foods, the fruits and vegetables, they got a lot of potassium, very little sodium. What about sodium? Isn't sodium, what's the problem with sodium? Well, it raises your blood pressure. It raises your stroke risk. It raises your risk of having kidney disease. Sodium is not a good thing to be taken in, and you want to limit the amount of sodium to about 2 grams a day, and you want to try to stay on a plant-based diet until, if and when, you're developing a problem with your potassium. And we're going to get into when that may happen. Basically, if you're on a plant-based diet, here's an interesting thing. We talked about this. I think I told you this, James. There was a study out of Sweden, and they found that obese patients that were on a plant-based diet, that they didn't lose their high BMI, they stayed obese. Plant-based diet folks that were obese had a much better survival than obese patients that were not on that diet. So this diet has protection for you. Get on a plant-based diet and don't worry about the potassium until you need to worry about it, okay? And don't be starting, okay. The other thing, so we say potassium is not poison. Just because you got stage 3 kidney disease, you don't need to stay away from potassium. As a matter of fact, you probably should be emphasizing higher potassium plant-based foods and lower sodium foods. What about the protein part? We're not going to emphasize that too much tonight, but no need to be obsessing about decreasing the protein in your diet, especially when you're at stage 3. If you're at stage 4, maybe, if you're not diabetic, maybe you want to take a chance on the potential benefit of a low or very low protein diet. And if you're, as I say in my book, if you're one of these folks that's losing kidney function rapidly, and usually that'll mean that you've got high levels of protein in the urine, then if it were me, I would do everything I can to slow it down, which would include a low protein diet. Again, not for diabetics, because diabetics, if you're on low protein, what are you gonna eat? You're gonna be left with carbs, so you're gonna be stuck. Not a good plan. Not recommended. Low protein, maybe non-diabetics having lots of protein in the urine, and losing kidney function, that's when I would think about going into that low protein or very low protein business. Don't obsess over it when you're in stage 3. Doesn't make any sense. Stage 3, your main message is healthy living, good lifestyle, get rid of the cigarettes, get your blood pressure control, get your diabetes control, get your bad cholesterol down, exercise, exercise, exercise. And a recent study just came out, and I think I mentioned this last time, even with advanced CKD, exercise will help you live longer, no matter who you are, no matter what stage you're at. So let's talk about what happens to the potassium. First of all, you should know that if you folks get your potassium measured, the normal potassium is roughly 3.5 to 5, okay? That's what's going to be on your electrolytes. So how much potassium is in your blood and how much is in your cells? It turns out that in your blood, it may be 4 or 5, but guess what? In your cells, it's 140. We are mostly made of potassium in our cells. Ooh. So the big issue with potassium problems is how much of that potassium is moving in and out of the cells from the blood, or from the blood into the cells, or from the cells into the blood. So keep that in mind. A lot of the deal has to do with potassium moving in and out of your cells. So what happens to potassium in your diet? If you got normal kidney function and certainly above 30, you're going to get rid of the same amount of potassium that you eat. Whatever you eat, it's going to be peed out. So what affects how much potassium comes out in the urine? Well, there is a substance which we have to mention called aldosterone. It's an important substance. The aldosterone is a hormone naturally produced by your body, and it's an important regulator of your potassium. Aldosterone is called a mineralocorticoid. Now, I know I'm throwing out big words, but you need to know them for the following reason. We're going to get into, in a few minutes, the drugs that are called mineralocorticoid antagonists. In other words, they block aldosterone. And in other words, if you block aldosterone, which is the hormone that helps you get rid of potassium in your urine, what happens to your potassium? It will go up. Again, aldosterone helps get rid of potassium. It does it in, if you folks have looked at the anatomy of the kidney, you have the little capillaries that filter, then you have the tubules, a bunch of tubules that produce the urine. So in those tubules is where sodium and potassium get exchanged. And the aldosterone is critical to get rid of the potassium. So when can you get into a dangerous potassium situation? If any of you have had something called AKI, or acute renal failure, and you've been hospitalized, you may have experienced dangerously high potassium. And there's a type of acute renal failure that's kind of unusual, but it will be a reason that you'll get hospitalized, where your blood pressure is real low and your kidneys will stop working normally. And if you're not making much urine, you can get quickly your potassium going up real high. And so the other reason why, if you're sick and your kidneys have shut down, that your potassium can get dangerously high is because the other thing that affects potassium, so we talked about aldosterone, right? That helps get potassium into the urine. Instead of going back into the blood, it helps get it out in the urine. The other thing that affects how much potassium is in your blood, remember I told you you've got about 140 of it in the cell and about 4 or 5 in the blood. What will affect how much is in the blood or in the cell? If you have more acids, if you've got a low pH or more acids, and as you get progressive kidney failure, some of you may have to take bicarbonate, which can help with the low acids. And if you get too much acid in the blood, what does that do? Some of that potassium will shift out of the cell into the blood. And then if you take the bicarbonate, some of that potassium will go from the blood into the cell.
Now,
So,
question about that, Doc. Does
yeah,
uric
yeah,
acid impact your potassium if your
no,
uric acid
you,
level is high?
no, no.
Okay.
Well, okay. Uric acid may go up, and I was just getting to something called tissue breakdown. For anyone who's been unfortunate enough to be treated for cancer and having to have those cancer cells destroyed, that is going to produce a lot of death of cells, and that could lead to not only high uric acid, but a low pH and a high potassium. Because don't forget, the cells have a lot of that potassium. Um, Now, if you're as your kidney function declines, your kidney will adapt. It will be able to excrete more and more of the potassium that's presented to it. And so there's a few things that are in this adaptation as you get lower kidney function. As we mentioned, aldosterone is going to help, and the pH is another factor. And here's the third factor, very important for diabetics. If you're diabetic and you're not taking enough insulin and your sugar goes up, you can get into a dangerously high potassium. Why? When insulin helps bring sugar into your cells, it carries potassium with it. So the big things that affect potassium, and notice I haven't even gotten to diet yet. That's a minimal player in the whole potassium story. The big players are the things that are affected to be abnormal, like abnormal aldosterone, abnormal level of insulin, abnormal level of acids, and the last thing is, you heard of the fright and flight hormones. They're called catecholamines, okay? And these catecholamines can also shift potassium, which is something kind of interesting. They found that people that were taking albuterol, which is a catecholamine to help you breathe better if you have asthma, it works to push potassium back into cells when patients had high potassium. How do you like that? So shifting potassium is a big factor in what's going to happen to your blood potassium. The other thing that most folks don't talk about, as you get lower kidney function, and we're going to talk about situations to expect potassium to go up and what to do about it. As you get lower kidney function, stage 4 and stage 5, you're getting not only the kidney to maximize how much it can pee out, but you're going to get rid of potassium in your gut. And guess what? If you get constipated, that can have an effect on your potassium, which most people are not aware of. So what is potassium? If you don't get enough potassium, it will increase your chances of getting osteoporosis, wasting of your bones, increase your chances of getting a stroke, increasing. It's related to having higher blood pressure levels. So get rid of the processed foods, get rid of high sodium, but don't get rid of the potassium or the plant-based diet unless you need to. And we're going to get into when you may need to. So it is true that a lot of people that eventually go on dialysis will get an episode of high potassium at some point. But there's high and then there's real high, and we'll get to that in a minute. The people that get into more trouble are going to be diabetics. And the diabetics may get into more trouble with potassium because they may get into trouble with the insulin. I told you the insulin helps get potassium in the cell. And remember I mentioned aldosterone. Diabetics also tend to have problems with low aldosterone. So if you're diabetic, you may be more prone to getting a high potassium before you go on dialysis if you get that far in your kidney decline. So what's the normal potassium range? We talked about 3.5 to 5. And so what do we consider to be mild potassium elevation is about 5.2 to 6. And patients living with a potassium in that range, I don't get excited about it. It is unusual unless you're getting above 6. I mean, that's not for everyone. I mean, some people may have a problem between 5.2 and 6. But by and large, serious potassium issues are above 6. And here's the issue. It's not what the level is, it's how fast it got there. So, for example, we talked about acute renal failure, your kidneys shut down, your potassium goes high quickly, that could be fatal. And as a matter of fact, I'll tell you a quick story. I was at a kidney meeting. This is an interesting story, James. You'll get a kick out of this. This was in the days when they had these scantily dressed, beautiful ladies for a Las Vegas night, sponsored by, the drug and the dialysis companies. They don't do that anymore. They clamp down on all that.
Don't do that anymore.
They clamp down. So everybody's drinking and boozing and gambling, and then there was an announcement. There's been an earthquake in Yerevan, Armenia. So I went up to the person who made the announcement. I don't know if anybody else heard it, but I spent the entire meeting organizing a relief effort of things to treat crush injuries. If you crush a person from an earthquake, you crush their muscle, and the muscle releases stuff called myoglobin, stuff part of the muscle, that can shut your kidneys down. And when you crush the muscle, it'll raise the potassium and it can kill you. So that can give you acute renal failure and death. I organized this thing. I'll give you the fast forward. I spent my whole meeting there organizing. All the dialysis companies donated machines. They donated K-exolate, which we'll talk about in a minute, which binds potassium for people who have high potassium. And I wound up getting someone who I know who was involved with Gorbachev's doctor. There's a guy from Harvard that was involved with, who knew Gorbachev's doctor personally. And I knew a doctor friend of mine that got this thing going. We eventually loaded all of these dialysis supplies, machines, and K-exolate on Russian planes. This is before the fall of the wall. This is while communism was still going, and we had U.S. Marines loading these Russian planes, and those supplies got to a pediatric hospital in Yerevan. So the message back to what we were talking about is you have rapid rise in potassium and it can kill. And you could get the rapid rise as your kidneys shut down. Basically, what happens when you have high or low potassium? It affects muscle. It affects heart muscle. It affects skeletal muscle. So you may get some numbness and tingling in your hands and your legs. And because it affects the circuitry of the heart, that's where the big danger comes up. It can affect your heart rhythms. And if it gets high enough, it can go from something called ventricular tachycardia to ventricular fibrillation, where the heart is fibrillating like this and it can't contract. Okay, fibrillation. So you don't want to ever get to that point in high potassium. But again, it's unusual until you get to much lower levels of kidney function than stage 3. So the biggest issue for any of you who are developing progressive kidney problems is preventing a high potassium episode. So when might you see it? One of the ways you may see it is if you're eating a lot of light salt. And I don't know if you know what light salt is, James.
Yeah.
And a lot of folks don't know what it is. It is potassium chloride. Potassium chloride. And people may say, well, I've got heart failure, I better be on light salt, but they may also have kidney failure and they may get into trouble. And if you're on diuretics, the diuretics which help you get rid of salt and water, but they also can get rid of potassium. And that's why we'll mention in a minute, any of you who are on these ACE and ARBs, which we've talked about over and over again, that are the good drugs to slow decline of kidney function, they can raise potassium. But if you're on the ACEs or the ARBs for your blood pressure, make sure you're on a diuretic. And that could help protect you from getting your potassium up real high. The big problem drugs that can be useful for patients on diuretics who have low potassium are the so-called potassium-sparing diuretics, and I think James may be on one. And the
I am.
potassium-sparing diuretics,
That's
yeah,
the
right.
S one,
It's
right?
spironolactone,
Yeah.
spironolactone or aldactone, triamterene or diuretium, and amiloride and eplerenone. Now, the interesting thing about these aldosterone blockers, remember aldosterone is the normal substance in your blood that helps get rid of potassium from your kidney. It turns out that just like ACEs and ARBs, some of those aldosterone blockers may have protective benefits for your kidney function decline. You're going to hear more about that in the future. I think a lot of these manufacturers are going to be pushing not only the ACEs and the ARBs and the diabetes medicines I mentioned last time, the SGLT2 drugs. All of these drugs may be combined to slow decline of kidney function. And so there's going to be a lot more emphasis on trying to keep potassium under control with these potassium binders that we'll mention in a few minutes. Other drugs besides the aldosterone antagonists are the NSAIDs, things you take like for headaches, Advil and Motrin. They can also raise potassium. Other common drugs that can raise your potassium are Septra. A lot of you get urinary tract infections, maybe on Septra or Bactrim. Other drugs, propranolol, which is a beta blocker, and labetalol. So these drugs block that receptor that the albuterol that asthmatics take. And so the albuterol can push the potassium in the cells. The blockers, the propranolol, labetalol, can get it out of the cells. And we mentioned the ACEs and the ARBs. So most of the time, if you're not at close to, stage 5, sometimes in stage 4, but mostly in stage 5, most of the folks who have a K problem have one of those drugs that are giving it to them, or they're just having a massive intake of potassium. So the low potassium diet is not by any stretch your first line of defense against high potassium. You want to see what's causing it. You want to stop the things that are causing it, the drugs, the high potassium intake in your light salt. And then you go to your dietitian who can help you figure out, if you're still having potassium problems, what are the foods that you should avoid. And I won't be discussing that. I'll leave that for Jen and the dietitians that are on your show. So look at the food labels to see how much potassium. I'll just say generically, look at food labels, see how much potassium is in the food. And don't forget, those food labels are for a 2,000 calorie diet. How many of us are on 2,000 calorie diet? Very few. Most of us are on 3 or 4 or 5,000 calories. So, it's not just how much potassium is in a particular food, it's how big your serving is. Okay. And I'm sure Jen has discussed this with you, but I'll quickly go over some of the tricks for folks that are having potassium problems. And I'm sure James knows about these. If you have ruled out the other causes of high potassium and you got to go on a low potassium diet, you want to just drain the juice from the cans of, canned foods that you're eating, canned vegetables. You want to soak fresh vegetables in water. You're actually dialyzing the vegetables. You're getting potassium out of them. And you want to dump the water in the pot after you soak the potatoes and other vegetables, and then you cook them up. So again, if you're having high potassium problems, try to prevent it in the first place. You want to avoid the light salt. You want to take, if you are not on a diuretic, you want to make sure you're getting a diuretic that can help get rid of potassium, and it's good for your blood pressure control. And the other thing that you can do, in addition to a low potassium diet, are the potassium binders. So if you're still having
Whoops, we just, his internet connection went down and we lost him. Hold on, he'll connect right back to us. Yeah, he's at, a different location. Okay, hold on. Here he comes, and
I'm sorry about that. We got a Wi-Fi problem. Yeah. Are we back?
That's all right. So you're just talking about potassium binders.
Okay, no. So there are 3 on the market. In my career, there was only one called Kxalate. I've used a ton of it. I've had patients with stage 5 CKD, kidney function numbers below 10, certainly below 15, managed for many, many months and sometimes even years on Kxalate. But there's a possibility of that Kxalate affecting your GI tract. So there's a couple of newer ones called Veltassa or Patiromir and Lokelma or sodium zirconium. So there's several drugs that can help bind potassium if you're getting into problems and it's not caused by your diet or something else that you can change. Let's touch on low potassium. What happens when your potassium gets, well, first of all, there's so much emphasis on high potassium, but it turns out that the best longevity, you could probably live the longest if your potassium is between 4 and 5 rather than between 3.5 and 4. So, and that probably reflects that people that have higher potassium are probably eating healthier. But anyway, that's just as an aside. If your potassium gets below 3.5, just like high potassium affects muscle, low potassium can affect your muscle too. It can give you muscle tingling, and if it gets real low, and I've seen this happen below 2, it can actually cause paralysis. So yeah, high and low potassium affect muscle. The high potassium, the big danger is affecting your heart muscle, which is really scary. And that will happen most commonly if it goes up very quickly if your kidneys shut down. So again, ways to prevent it is try to be on a diuretic with your blood pressure medicine. Watch out for the potassium sparing diuretics. And if you're having any kind of trouble with fluids, a lot of you are going to be on diuretics. So there's 2 types of diuretics. There's the thiazides, or 3 types, right? Thiazides, loop diuretics, and potassium sparing. So what are the thiazides? Most of you who are on blood pressure medicine should be on a thiazide diuretic. And that is either hydrodiuryl or HCTZ or diuryl. And the other one that I use a lot of is metolazone or Xeroxilin. You should be on one of those with your blood pressure drugs, and that'll help keep your potassium from going up too high. The loop diuretics are furosemide and ethacrynic acid and bumetamide or Bumex. Now, some of you, and I've said this before because I've seen this over and over again, some of you may be having problems with fluid, and I just see so many patients where their doctors, their providers, their nurse practitioners, their physician assistants, they're not using adequate diuretics. And you can combine diuretics to use like a loop diuretic with a thiazide. And if you give enough diuretic, you can get rid of most people's edema. But in many cases, that can lead to a increase of potassium. But it may delay a decrease in potassium. If you're using lots of diuretics to control your swelling, your edema, you may see a rise in your creatinine, a drop in your EGFR. So let's say you're a patient who's got a EGFR of 10, 12, whatever, and your doctor gives you a bunch of diuretics to get the fluid off. And if it were me, I could do that. And then your EGFR went down to 8, but you were fine. So you may or may not need to start on a kidney machine. But if you have intractable potassium problems, if you have intractable fluid problems, I'm fine with people going on dialysis when you get to that point. But there are lots of folks that could be managed medically, but it's a lot more difficult for your provider than just putting you on dialysis, frankly. And I've had patients who had kidney function numbers, let's say a kidney EGFR 20, and I take off 40 pounds of fluid with diuretics, and the EGFR goes to 10. And I followed them for quite a while, and they did fine. So this is something, just if you're in that situation, discuss it with your doctor. And with the binders that are available out there, there's the ACEs and the ARBs, and sometimes even the potassium sparing diuretics. They may be shown, and the ACEs and the ARBs have already been shown to help your heart if you've got heart failure, to help slow kidney function decline, especially if you've got high levels of protein in the urine. And folks can get, as we talked about, a drop in your kidney function with beer. And sometimes ACE or ARBs are going to cause an increase in potassium. So I think the trend in practice is going to move more to continuing these ACEs and ARBs, and maybe even the potassium-sparing drugs, with some of the potassium binders. I think that may be the future of how we're going to be managing patients. So I think we're going to be much less concerned. But I mean, I don't want to minimize potassium as a potential killer. I mean, if it goes up quickly and it gets high enough, it can kill. But for most folks, as long as you are aware of things that can be affecting your potassium, and your providers are, you can keep it under control, certainly until you get to at least stage 4, and probably for many of you till you get to stage 5. Diabetics may have problems earlier, as we mentioned, because their aldosterone levels may be a problem, and their insulin is a problem. And if you get advanced kidney disease and you have a massive potassium intake, you can get your potassium high. There's no question about that. So let's start answering some questions, James.
Yeah. Well, while you were talking, you were mentioning about how your potassium can actually be too low and it could be a problem. And I just wanted to emphasize how we all are different. I'm one of those people who, for some reason, my potassium goes low. And I looked up my original labs while you were talking. When I went into the ICU for a week, my potassium, it says critical result 2.8 was where mine was. Yeah. And they put me on IVs to give me potassium. And I'm now on a high potassium diet. I do take that potassium sparing diuretic. And I just got new labs last Monday when I got my vaccine. And my potassium looks great, 4.4, even though I'm on a high potassium diet. Because some of us, just to emphasize to everyone out there, we're all different. So you got to work with your doctor. Don't assign a diet for yourself just out of the blue or from something you read on a Facebook group. Whatever you hear, it should be check with your doctor for you. Let me check. We did have a couple questions. I am so glad that my potassium is holding steady at 4.4.
Yeah. I mean, I think I mentioned this to James. I mean, there are situations where people have low aldosterone, which is very common. And then there are rare situations, which I think James is one of them, where people have high aldosterone. And so that's an unusual situation. Most folks have either low aldosterone because they're diabetic, or they may have a drug that they're taking which will block the aldosterone, and it blocks potassium excretion.
Here is a question. I see this in a lot of the message forums. Are there any urine dipsticks that can test accurately, I want to add that word, for potassium?
No. I mean, that's an interesting thing. Potassium in the urine is not useful. Potassium in the blood is what you're worried about. And so, we don't have dipsticks other than for sugar that I'm aware of, or A1C. But that's a good question.
Yeah, I've heard, I've seen a lot of people talking about ones for protein, but then I saw a few doctors weigh in and say, those aren't real, or those aren't accurate. Stop buying those.
Yeah, so someone was asking me about stage 3, what kind of protein. So, I mean, in general, whether you are on the DASH diet or a Mediterranean diet, these are all basically plant-based diets where you get most of your protein from plant sources like beans and so forth. So that's the kind of protein. And as far as the DASH diet, they recommend minimizing your red meat, eating more fish for your protein source besides the beans, and eating maybe poultry, but take the skin off. Try to stay low on the fats, or the saturated fats.
Now, a few people out there haven't heard of light salt. I see them all the time at the stores, and it sounds healthy. You see it, light salt, contains no sodium, but they're loaded with potassium. So for kidney patients, my recommendation is look at spices. Dash, formerly known as Mrs. Dash, they have ones no salt. They're not loaded with potassium, and they just use a mixture of spices to help add some flavor to your food. And that's a great alternative to salt without adding potassium.
Someone asked us a good question: how often to check your potassium? So here's the first thing. If you ever go on a water pill, you want to know how your kidneys are going to react to that water pill. So once you go on a water pill, a diuretic, you should have your potassium checked. If you're on a water pill, which is one of those potassium sparing, you certainly need to get your potassium checked. What happens, the commonest situation when people get into dangerously high potassiums, is they'll be on one of those water pills that blocks potassium excretion. They're going to be on an ACE or an ARB. Remember, the ACEs are the prils like lisinopril. The ARBs are the TANs like losartan. You'll be on that kind of drug. You're going to be on potassium sparing diuretic. And often you're also taking Motrin. So you're on 3 different drugs that can raise your potassium. And so, you just have to be aware, especially as your kidney function goes down, or if you've had an episode of high potassium, that you want to prevent future episodes, and you want to avoid the things that can raise it, like the things we just said. If you're having trouble with high potassium, watch out with your ACEs and your ARBs. Watch out with your potassium-sparing diuretics. Watch out with your NSAIDs, your Motrin, and so forth. And also make sure if you're diabetic that you're keeping your insulin up and your sugars down.
All right, here's a great question from a little bit earlier. Is your book available in Spanish?
No, I'll tell you, I've got colleagues that have asked me about getting the book translated into various languages, but I have not done it. And I think that in the future there's going to be easy translations of anything in written form or in spoken form, but I'm not aware of it yet.
Nope.
Someone says on stage 4 pre-diabetes, should I stop eating meat or fish? No. I mean, basically, if stage 4, again, the big issue is not your stage, but how quickly your kidney function is changing. It's not your absolute number of your EGFR. It's where it's going, and it's whether or not you've got high levels of protein. If you got high levels of protein and you're already at stage 4, you may want to cut your protein levels down. And you want to start being aware that the plant-based diet could start causing problems as you get into stage 4 and 5.
I'm answering a couple questions, typing them here.
Okay.
Someone had asked about Himalayan sea salt, which is a great salt to use. And when it comes to salt, you just got to make sure not to use too much. Your body needs some salt. It just doesn't need too much. And your doctor will set your target. From what I hear, most people were around 2 grams, right?
2 grams.
2,000 milligrams.
2 grams. Yeah.
Yeah.
And
that's why you got to
hydrochlorothiazide.
avoid those prepackaged foods and highly processed, because they are loaded. You could have one thing with an entire day's worth of sodium in there.
Yeah. Oh yeah. It's very easy to 2 grams is a day's worth of salt is a teaspoon. If you get over a teaspoon, you've already hit more than a day's worth of salt. Hydrochlorothiazide is not a potassium sparing drugs are the ones that raise potassium, not your thiazides, not your hydrochlorothiazide, diuryl, metolazone. They are not potassium sparing. The ones that are potassium sparing, the common one is spironolactone and triamterene. Those are the 2 common ones that can raise your potassium. If someone's on low, yeah, go ahead.
Go ahead.
I'm seeing somebody, if I'm on 100 of losartan, should I watch my potassium intake? No. If you're on losartan or you're on any of the drugs that we mentioned that can potentially raise your potassium, after you start on one of these drugs, you should have your labs checked. Your doctor should check your labs. If your potassium's running fine, you're good. And I wouldn't necessarily expect it to go up. But again, as a way to improve the efficacy of blood pressure drugs like losartan, being on a thiazide is a good idea. It can not only help get your blood pressure better, but keep the potassium under control.
Here's a great one from Krista. So she's got some lab results. Last month in August, her GFR was 50. 4 months before that, it was normal. Then at the end of the year, her GFR was 70. What does that mean?
It means a great example of what I talk about in my book. One number is meaningless. And as I've said before, and I've been on these Facebook groups, whatever the group is related to kidneys, people say, oh, my kidney number went from 40 to 50. It means nothing. Or 50 to 60. It means absolutely nothing. You need to have repeated values of your kidney number over time, and that's what matters, because that is a great example. Kidney numbers will bounce around all the time. I can't tell you how many consults I had where patients had an eGFR of 40 and their kidney number was good 6 months ago, and I rechecked the labs and it's normal. And so don't get excited over one value. And that's why to define having kidney disease, you need at least 2 values that are below what we would expect for you at your age, at least 3 months apart. So that's a great example, James. Great
and
example.
Being dehydrated, which is so easy to have happen and not even realize it, could have such an impact, a negative impact on your eGFR. That may have been possibly something that contributed to one of her lower numbers. I used to think I was hydrated properly, and then I learned, no, you're dehydrated. And then I learned how much water I needed to drink.
And a lot of it is going to be variations in the testing parameter factors, how the blood is taken, how it's being tested. I mean, most of our lab testing devices have a pretty tight range, but the range is at least 10%. So if you're 2, it could be 2.2 or 1.8, it would be the same number. So it's not that exact. Now, somebody talked about switching off losartan. I mean, there are doctors, and I'll say this, and I'm not your doctor, and I can only give you theoretical stuff, and you can discuss it with your doctor. But if you have kidney problems, your kidney number, let's say, is stage 4, is 15 to 30, or let's say 30 to 45, those are kidney numbers that are of some concern. If your kidney number on an ACE or an ARB goes down, the recommendation from most kidney experts is to continue the drug as long as it hasn't gone down more than 30%, because it's expected in some cases to have a temporary decline. And if you're one of the folks that is on an ACE or an ARB for your kidney problem, and you've got high levels of protein in the urine, you might want to discuss this with your doctor. Is it reasonable to continue the ACE or the ARB, even though I've had a jump in a decline in my kidney number? Or some of you, like we said, may get a jump in your potassium from the ACE or an ARB. So, you know, Ariana went from 13 to 19 and attributes it to the plant-based diet. I mean, Ariana, it's possible. Okay, so here's another misconception. And I talked about this, James, in the discussion about reversible declines of kidney function. And you just mentioned one of the commonest reasons for reversible decline. Mm-hmm. So Ariana, your 13 may have been what James just talked about. It may have been related to your state of hydration. It may have been related to a medication that you were on. We talked about medications that can cause a decline, and often it's temporary, of your kidney number. So to attribute your kidney number going from 13 to 19 on anything, whether it's a plant-based diet or so forth, I don't think it's really reasonable. The plant-based diet, just understand why you're on it. You're on it to decrease not only your risk of kidney progression, which it may help it getting worse, may help it from getting worse. There's no proof that it can help it to get better, but it can also help keep you alive longer, to keep you from having progressive hardening of the arteries, which is the main reason to know that you've got, let's say, a stage 3 CKD.
Yep. All right, Doc, we are now coming up at the top of the hour. So I want to thank everyone out there for joining us today. If you haven't subscribed, subscribe to Dadvice TV on YouTube. Visit dadvicetv.com and see all of Dr. Rowe's videos. And if you're interested in his book, there's that link right there. go.dadvicetv.com/book. It's also down below in the description. And for those of you who haven't, picked up a copy of his book, this is by far the best book for those of you out there who have kidney disease. There was one book-related question for you, Doc. I do want to squeeze it in real quick. Any luck on a second book?
All right. Well, actually, James, I've decided. I was going to write a generic book on diabetes, but I've decided that to my knowledge, no one's written a book about diabetes and kidney disease. So I'm going to be moving my emphasis of my book to diabetes and kidney disease, and there's a lot to talk about. And we'll talk about it on some of our Dadvice TV programs.
Awesome. All right, Doc, thank you so much for being here. It is always great to have you here, and you are a wealth of information. Everybody else, I will be here tomorrow night with Jen Hernandez. We are going to talk about why your kidneys are important. And we've touched on some of that today because there's a lot of things they do for you. All right, everybody, I'll see you in the next video. Bye.